Hello, everyone. So today I'm going to talk about artificial intelligence in medical devices and the challenges, some of them, posed by the AI Act. So before starting, just a quick introduction of myself and our company. So I'm Manon Marault, co-CEO of Spartacare. We are a consulting agency specialized in helping digital medical devices manufacturer to navigate the CE marking. So let's start with a summary of the timeline. So there are three important dates here. The first one is, as you know, was last summer with the official publication of the AI Act. And still ongoing is the development of harmonized standard. For example, 4201, we don't know if it will be harmonized. The second one is by August 2025 with the designation of a competent authority in France. For the moment, we heard a lot of things, CNIL, ANS, we don't know yet. And the last important date here is by August 2027 with the mandatory application of all requirements of the AI Act for the high-risk system. High-risk systems are products as defined as medical device above class 2A. So they need to require the MDR or IVDR and whose conformity require assessment by a notified body. So let's see some example of different types of medical devices. I don't have time to detail all of them, but what's important to note here is that not every device will face with the same level of scrutiny regarding the AI Act. For example, Class A under the MDR or class under the IVDR and Class 1 under the MDR just have to fulfill the requirement of transparency obligation that I will explain in more detail just shortly. So let's go over to the most important step to be compliant with the AI Act. And the first one is building an AI management system that complies with the ISO 4201. And this is similar to the building quality management system under the standard 13485. And important information here is that Articles 47.3 and 48.5 of the AI Act mention that AI-based system can have only one EU declaration of conformity, and this means for manufacturer they can only create one quality management system and one technical documentation that cover all the requirements of both MDR, IVDR, and the AI Act for sure. The second step is the adaptation of the technical documentation for sure. And here, the AI Act and the MDR or IVDR are similar, but for example, they both require a post-market surveillance and change management processes, for example, but they have some differences, and I put some of them on this slide. The first one is the key focus of the AI Act, the quality and quantity of the training data set. So this needs to be justified, and it depends on the intended use of your device and the complexity of the AI-based system, for sure. But for the moment, there is no clear guideline on how to determine that. We can take, for example, the FDA guideline for this board. The second one is you need to implement a risk analysis process and to perform a risk analysis on your AI system that comply not with the standard that we all know, 14971, but with the ISO 23894. And the last difference is here is the human supervision and transparency for users. And that means users need to be informed about the performances of the AI-based system and as well as its limits and its biases. And the last, but not the least, the selection of the right notified body. The notified body should capable to certify your device both under the AI Act and the MDR or IVDR. And I advise you to reach out to your notified body now to know if they plan to be designated as a notified body under the AI Act. Because this raises two questions. The first one is that if your notified body doesn't plan to be designated under the AI Act, does it mean when you need to just change your notified body or to work with two notified bodies? And either way, it's more complicated. And if your notified body plan to be designated under the AI Act, how long does it take to be designated as a notified body? For the moment, I don't have the answer, sorry, for today. But it's a challenging part for manufacturer. Just to conclude very, very quickly, so the AI Act brings a lot of challenges. Some of them we've seen today, but there are many more for sure. And I cannot enter in detail here, but I'd love to discuss more about that if you want, just after the meeting. And thank you for your attention.